I was the kid who knew he wanted to be a doctor when he was 10 years old, and so achieving that goal, I thought that was going to be my highest aspiration. But after spending 15 years in healthcare, I, like many people, realized how broken things were. As an emergency physician, it's a very downstream medicine approach. When I see someone who's having a heart attack, I considered that to be a medical failure. Ideally, we would be treating the cholesterol, we'd be treating the hypertension, we'd be dealing with the smoking upstream. And it seemed like every day I came to work, I was just dealing with the failures of the medical system. So my desire was to have an impact upstream. And as I started to learn about population health and accountable care, that was much more appealing to me because it seemed like a better use of our precious healthcare resources. I didn't know how to get from a downstream to go upstream, and that was part of the journey of me coming to SOM. My intuition about coming here was more about learning tools and techniques. When we were learning some of the more, just the academic exchange of information, operations theory, for example, I immediately applied that in our emergency department, used queuing theory from Art Swearzy's class to reduce wait times in the emergency department. In terms of the more impactful career development, that was very soon after I left the program. And that was simply because I had positioned myself as a go-between between the administration and the medical staff. And when you have the credibility of a working clinician, and then you layer in the credibility of your business training, you can be very effective in that role. And it's remarkable how that is valued now in healthcare organizations. MD, MBAs are not unheard of, but they're uncommon. So immediately it seemed like I was being sought out for a lot of involvement in ever increasing levels of responsibility. Almost 6 years since I left here, I've had hospital leadership roles, I've had internal consulting roles, and I now have a senior leadership role in the healthcare organization, specifically as president of the medical group. When you come to a program like this, of course you're going to learn those tools. But the real value came from the richness of the dialogue that went on in the classroom. After the students come to know and like each other, then suddenly you look across the room and say, look at you, you're on the payer side, you're my arch enemy historically, but I like you and I respect you. So now I can engage you in an intellectually honest conversation about different ideas. So into the end of the first year, and certainly in the second year, the quality of the interaction and the dialogue went through the roof. And that's where the value is. On a pragmatic level, there is now a network of 300 or 400 graduates of the EMBA program that are dispersed throughout the nation, obviously concentrated in the Northeast, and those are paying professional dividends all the time. But it's the personal link that continues to be one of the big joys of my life.